Coming up today, innovation in the operating room. Meet a nurse turned inventor who came up with a way to improve safety while also saving time. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. All this week, we are celebrating National Nurses Week and highlighting the work of the nurses and nurse practitioners here at the University of Kansas Health System. Today, we are meeting a nurse who saw an opportunity to improve the workflow inside the operating room. And more importantly, she spoke up and put in the work to make her improvement a reality. Her idea involves sterile sponges, those cloth ones used to soak up blood and keep things clean during a surgery. It is, of course, critically important to keep track of those sponges and not leave any of them inside a patient. So I am sitting alongside Lori Hassel-Chuang, one of our nurse educators here at the University of Kansas Health System, who came up with a better way of tracking those sponges. Good morning.
Good morning.
Excited to hear about your new inventing venture.
Thank you.
We're also here with Teal Sanders, an OR nurse who can really help us understand kind of all the moving parts inside an operating room. I know that's kind of all in a day for you, but it's kind of exciting to know, kind of take us literally behind the sheet there. Great to have you both. Lori, before we speak specifically about your invention, just kind of help us understand what's happening inside an operating room,
Sure.
especially the importance of what you all call the sterile field.
Yeah. Well, I mean, without the sterile field, we have no safety for our patients, right? So we always want to prevent surgical site infections. And so, you know, it's crucial. I mean, if there's ever a question, we're going to get rid of something and start all over again.
So what is a sterile field? This
Sure.
is something you set up. Tell us literally, like, walk us through.
Sure. So we'll have like a surgical pack. We'll have drapes that we put over our tables, and then we'll put all of our sterile items onto that table to create that sterile field. And then the patient, of course, in a sense, is becoming that sterile field as well. So we will drape out that patient, and then that's where our surgeons and residents will be working, is at that sterile field. So they'll make an incision, and then they will work on whatever procedure that they are going to be doing that day.
And it's something you have to keep that sterile field
Yes.
going throughout the entire length of a surgery.
The circulator is constantly watching to make sure that we don't have breaks in sterility. Our surgical techs, everybody in the room is a lookout for the sterile field.
What's the circulator?
Circulating would be the nurse.
Okay.
Yeah. And so, if we have a break in sterility and someone doesn't notice, that's what can harm our patients.
No joke. I don't know any of the nurse lingo, so I got to bring everyone inside with me. I hear it. I think I know what you mean, but I always got to ask.
Sure.
So during a surgery, a lot of different things in the field, in the sterile field, as we know, as we can see here. How many different medical devices or pieces of equipment could possibly be involved in one single surgery? Teal, you're like, oh my gosh, where do I start?
Exactly. That's exactly it. You know what? Literally hundreds, and that's not an exaggeration.
How do you keep track of that?
That's just it. We count most things that are going onto the field. If it can be something that possibly could be left in, we count it. So everything is that we place into the sterile field, we count that item. And that is very important. And that's where Lori's invention came in.
So let's talk about these sterile sponges. So what's the ballpark number of maybe how many sponges could be used during a surgery? I would imagine it varies, but give us kind of put it to perspective, how many might be in there?
If we're doing no surgery is really small, but if we're doing a smaller surgery, so to speak, we can use just maybe 10. But if we're doing trauma, we can use anywhere upwards to 200 or more sponges. So
especially if it's a longer surgery.
it's a longer surgery.
So how
Correct.
are the sponges used? Specifically, when do they come into play?
Probably one of our most important sponges is a laparotomy sponge.
Correct.
And we use that during the surgery to basically stop the bleeding. They use it for bleeding to move. They also may use it to retract body parts, for lack of a better word. So that's what we use those
And you're
sponges
just
for.
using them to soak up.
And we're using them to soak
way you would
up
at
the
home.
blood.
You're soaking up stuff, right?
Exactly.
Keeping the surface clean.
Exactly.
Exactly.
So that the physicians and nurses can do their job. So we know it's a rarity, but we have heard of these cases where a sponge gets left inside someone. How does that happen?
Well, I mean, there's a lot of factors that come into play. So some of those risk factors have to do with excessive bleeding. You could have a procedure that's planned a specific way, but then things go awry. So, maybe you're doing a cholecystectomy and then you're doing a bowel resection that wasn't anticipated. So it's those instances, or when you have a combo case where an additional surgeon is working, and so communication is very, very important. And when you have those unanticipated changes,
Right.
that's when you can anticipate that's a higher risk.
So you go in with 100 sponges, but then something kicks in, and now that math goes out the door, and you got to or you're kind of recounting, or you're in your head trying to figure out.
It gets
Correct.
chaotic.
It gets chaotic.
It gets, and it's moving, very fast, and so we're constantly, adding, supplies to the field. Some of them are countable, like Teal was saying. Some of them are not, and we have to be attentive to that field. We have to watch, to make sure there's no breaks in sterility, and then service, everybody at the field. So that's our job, but if we're not able to do that, then that's when we can miss
I'm
things.
so glad I do not have that job. That was making me anxious just thinking about the importance of that job. So every operating room we know needs a sponge accounting system, which is SAS. Certainly not a new idea, but Lori, you saw room for improvement. First, explain how a typical SAS system works.
Sure. So, I mean, of course, as we were describing, you're throwing those sterile the sterile sponges on the field, but once they are used for their purpose, they're thrown off the field. That's when we really need to account off the field. So we will put a sponge bag on the sponge accounting system, and then we will load those sponges into the bag.
So it's just hanging there?
Correct.
And you can see them?
Correct. But the problem comes into play when you have to stack the bags. So each bag that you place over the next bag, as that circulating nurse is lifting the bag, there is the chance that you're going to miss that sponge at the top.
Got it. Okay. So,
And the more bags you have stacked, the more risk that is there.
so you're working one day and you're going, this is how inventing starts. So you're going, wait a second,
Exactly.
something could be better here. What kicked in?
Well, I mean, every nurse has had a workaround in some capacity. So, some nurses will take those bags and they will take them off the sponge accounting system and lay them on the floor, or they'll tape them on the wall. Or they have to lay them on the sterile field because they need that peace of mind that they are leaving no sponge in that patient's wound or cavity. And that's where that never event can come into play. So we have to protect that patient. But instead of having a workaround, why don't we have a better product?
All right. So look, we have a video of the invention that you created.
Yes.
Telescopic SAS. So talk us through what we're seeing here.
Sure. So this video is highlighting what this prototype can do for us. So some of the really important things are the visibility. So I've done a lot of data collection with our staff, and one of the things that they are most concerned about is the lack of visibility with basic sponge counting systems. So this in itself is going to increase the visibility. It gives the nurse and the surgical tech peace of mind that we're not leaving a sponge behind. You can estimate blood loss. There is less work, from the circulating nurse, because our job is not to handle biohazardous sponges. Our job is to be attentive to the field.
So on the left side, we're seeing this stacking you were talking about, where
You got
something
it.
can be missed. Here, it's almost like a whiteboard. It's like this thing where you can just see it all right there.
Correct.
There's no having to go. And the time you're saving, right? Because you have to, every
Yes.
time they get a new bag, you have to take the gloves off. Talk us through that.
Well, I mean, OR time is expensive, as we know.
Exactly.
And the risk to the patient to stay intubated longer if we have a miscount, that in itself is, a money saver for hospitals.
So on the left, still stacking. Over on the right, now we're counting.
Now we're
got it.
counting. And everyone in the OR can see that.
Yep.
The surgeon can see it. Your surgical tech can see it. Anesthesia can see it, because they also need to be able to track the blood loss.
That
so
visual
it's visible.
cue,
Exactly.
that visual cue, where you're not having to
Exactly.
ask another person, hey, go lift up those bags, see what's going on.
That
or
is exactly it.
You got it.
It makes such a difference.
So in general, most important, patient safety. So how are we making sure that's keeping our patient safe?
Yeah. I mean, let's see. Unintentionally retained items in the U.S. alone, it's a $2.4 billion industry per year. So I've met a young lady who had a grandfather who had a retained sponge, and it can cause permanent disability. It can cause death in our patients. And it just depends on our patient's body, how their inflammatory response, reacts to something foreign being left in their body. But the young lady that I met, her grandfather had a permanent disability after he had a retained sponge 20 years prior to that. When the surgical team went to remove that sponge from his chest cavity, he had a stroke and he never walked or talked again. And in fact, that young woman told me that the only word that he could mutter was his wife's name, Virginia. And she even shared pictures with me, and which I was able to share at my podium presentation I just did at AORN. So she wanted me to tell a story.
So you're connecting something as simple as a sponge in an OR.
Yes.
It's like all in a day. Again, you see these every day, but then you're connecting it to a real life story and how that efficiency and safety matters.
One retained surgical item is too many. And
We don't want any.
if we can get this to other hospitals, this could help patients around the world.
Since this idea has come to light, Teal, how have you noticed improvement? Because I know at the health system we started using this improved SAS.
Well, as you saw, we can see everything. All the laps are not stacked, so everything is visual. And so it makes it so much easier for us. You can go back when you're counting. You can say, hey, we have this empty bag. We have this spot that does not have a sponge in it. We're supposed to have this amount. These numbers are not adding up. So it has been such an important part of our counting system now. And I don't know why no one has come up with this before, because it really and truly has made it so much easier.
And that's what we say about everything that gets invented or improved on.
That is true.
So Laura, you get this idea. Who did you first talk to about this prototype? What was the process?
Sure. Well, originally I came up with the idea because we unfortunately had a retained surgical sponge. And so I was tasked with looking for a product that was commercial in nature that we could purchase that would keep our nurses from stacking the bags. So I talked to a product specialist here. I looked online to find out what other products were out there because I thought we were just purchasing something so we can change our policy. But there wasn't anything. And so I asked, well, why don't we just make something? And, that person said, well, it would be really expensive. I said, but what if it was better? And so I went to my meeting, I did a little digital mock-up, I talked to a couple of trusted colleagues, Teal was one of them, and I had this idea, and I had this, it was all written down on what I wanted it to do, and then I got hooked up with the innovations department because they fell in love with the idea. And
tell people about the innovation department
Sure.
here. I think it's very cool to know that there's actually an inventing, a department where you could go and take your ideas.
Yes.
Initially, I didn't even recognize that it was a potential product. I thought I was going to make a custom product for our hospital. But this is not a unique issue to just our hospital, right? The innovations department has been wonderful to me. John Rochelle's been wonderful. They have helped me learn about innovation and to truly understand that this is innovation in nursing. And we come up with a lot of workarounds, we come up with a lot of ideas, but we don't always come up with a product.
Yeah, and Teal, talk about how I think we all do it in some ways, but when it comes to patient safety, it's interesting how we find ways to adapt with what we've got, but why not make it better?
And that's exactly what that has done. It has most definitely made it better. As she said prior, the stacking was always such, you just would shake your head and you're like, constantly say it was, and you're constantly
and breaking
saying,
your flow in the OR,
because you're constantly going, you're like, oh my gosh, we have to do this again, there has to be a better way. So you're constantly saying there has to be a better way as you're doing the case.
But you're too busy to do anything.
You can't do anything right now, but do this workaround.
You're too busy to come up with a new invention.
Right, because you can't do all you can do is the workaround because you're so busy in the room. So
is it still a prototype? What are the next steps?
Sure. So we have the 7 prototypes within the healthcare system, and I'm working with different manufacturers looking for the right partner so that we can make this prototype actually transform into a commercial product, get it to scale. And, it's a very interesting process behind the scenes. It's very complex. I'm learning so much. I feel like I'm getting a mini master's here.
Yeah, I bet you do. I bet you do. So be sure to ask your questions. You can use the chat on YouTube or Facebook. We are on the X platform, or you could email the Medical News Network. Information is right there on your screen. Dr. Hawkinson, good morning. It's Nurses Week, and I think we can't say it enough when we've said it before that this place just runs on the brilliance of our nurses. Right?
Absolutely, and they're minute-to-minute care of the patient, so extremely important, and so thankful for them.
So no COVID count, as we're reminding folks, but let's talk bird flu. It remains the biggest news in public health and infectious disease. So right now, it's a huge concern for dairy cows and people who work around dairy cows. There is exactly one known case of the virus jumping from cow to human. But Hawk, do you feel it's only a matter of time before bird flu learns how to spread from human to human? How does that all work?
Yeah, so we'd just like to say in general, the respiratory viruses overall are continuing to tail off throughout the country, especially, again, influenza and RSV, but also SARS-CoV-2 levels are decreasing in circulation as well. Avian influenza, or highly pathogenic avian influenza, in this case H5N1, does seem to be circulating through dairy cow herds. You are correct. They've also seen it in other animals, as we've heard, such as goats, cats, and other animals as well. There is a concern that it could have more infections in humans, and especially more infections that really go undiagnosed. I think there is that concern right now, or recently in the past month or month and a half, that there have been further infections. Now, we should note that there have been other outbreaks of avian influenza going as far back as 1997. They don't have what we call sustained human transmission, but we have seen non-sustained human transmission. That means if a person has it, they may spread it to 2 or 3 other people, not this large epidemic or outbreak that we can see with other viruses. Now, the main concern is, because we know that it has jumped from birds to cows into other animals as well, there is always that concern, especially if it does get into pig herds. Pig herds can also be infected by human influenza viruses. Pigs are excellent vessels for mixing different viruses because they have the different receptors on their body to accept those viruses and be infected by those viruses. And when viruses get into a cell, they are able to mix and form hybrid viruses. So there is always that concern. We need to continue to have increased surveillance around the country, both in our animals, but also in humans looking for symptoms as well. So there is that concern. Right now, there's not a lot of danger of sustained human-to-human transmission. There is the possibility that other humans have been infected. We just haven't diagnosed it, but we need to continue to be vigilant and monitor.
Hawk, thanks so much.
Yeah.
Let's get to some questions from our viewers this morning. First one is Lori making money off the idea, or do you hope to? Let's hope you do.
Well, of course, I never came up with the idea with the intent of making money. I have not made a dime to date.
Correct, okay.
But, I would never say no if money ever came about someday.
I wouldn't let you say no. Would not let you say
Exactly.
no. Well deserved.
Exactly.
Well deserved, right?
Yes.
Is there a similar accounting system for other medical equipment, or is it just the sponges because there's so many? How do you keep track of the 1 or 2
Well, we have
scalpels?
for the scalpels as well as for the needles that we use. We do have an accounting system. There's a box basically, and it has a sponge in it. It has numbers on it, and we place our sharps, as we call them, into those boxes, and we count those. When we get to a certain number, then we can count them off the field. So there's less on the field to worry about counting. So there is an accounting system for basically for everything that we do.
What is the longest surgery Lori or Teal has been a part of? Can you think of that one?
Oh gosh, it just depends. Spine procedures can be pretty long.
Hours. Ballpark the hours. How many hours?
Oh gosh, it could be an all-day case.
All day. If you start at 7 in the morning until
12s.
8 or 9 at night or later.
Try to do you work at? I kind of take us behind the scenes. I don't know if we have any of that video of you guys in the OR still, but what's it like? Are you able to step away and you come back and you kind of regroup?
as long as someone's actually giving you a break.
It's the handoff. It's
is the
passing the
really is
baton.
it is passing the baton, and that's the beauty of nursing,
Yeah.
especially in the OR. It's like that in every aspect of nursing. I think you have the shifts.
Right.
So
What's it like in an OR, though? I mean, I would imagine it's different with different teams, but I mean, is it fun?
it is
a
fun.
lot of
I
fun.
heard
It
they
is
play.
fun.
Sometimes docs play music.
They
Is this
do.
true?
They do.
Okay. Okay.
They
You're
do
like
play
a
music.
DJ as
Hello,
well.
DJ.
Yes, you're the DJ, you're the operator, you're answering
You're the
phones.
sponge counter.
Exactly. You're doing all of that in the operating room. So
Right.
We do it all.
we really do. And I think that's one of the things that nurses oftentimes don't know about the OR, because we're kind of the hidden gem.
You are the hidden gem.
You don't get it in nursing school. So when you come to the OR, it's totally different nursing than anything you've ever done.
Okay, another question is, how is the real OR different from what is portrayed on TV ORs? I mean, we could have a whole show on it, I'm sure, but what would you think would be the one thing that you're like, that never happens? Go on, let us have it.
I think one of the things, honestly, some of the things are, because I have to say the surgeons really are good. And they have their moments just like everyone, but I don't know. When I'm watching one of the shows, which I rarely do, I'm always like, okay, that really doesn't happen. And I guess one of the things is they'll be in a bad accident, and then they're not intubated. They don't have a tube in. They just have
Yes.
cannulas on, nasal cannulas on.
It's really
oxygen.
true.
They just have oxygen, and I'm like, they should have
yelling
a
at the
tube in.
TV. Don't
make an
I'm like, they should
incision.
have
They're
a
not
tube in.
asleep.
They're not even doing this right.
And it's probably not as sterile as you would
Oh,
like it to
no,
be.
Exactly.
for sure. You're ruined once you're in the OR for anything in the public arena.
Well, it's the same. Yeah, I think that's with any time. Anybody sees what they do
Yes.
portrayed on television, it's like,
I don't think
not
so.
so much, not so much. So how does it compare, though, to working in other areas of nursing? I mean, is it, you love it? I bet it's just fast and furious and fun.
Unique arm.
I love it. I love it. Also worked in the ICU and other places, but I love that too. But I really love the operating room. I started in the military, so it's someplace that I truly enjoy.
Oh, I bet your military background comes in handy in
It
there.
does. It
Getting
does.
things in order.
So I can't say enough about the OR. And when I hear people are kind of, they want to get into something else, and I see them like in the waiting room or in the lounge, anywhere I see them walking around, I tell nurses, come on to the OR. It's great. And they're like,
So true.
I think about that. I said, come on, we're always hiring. It's different than anything you'll ever do.
It's so true. Yeah.
Anything you'll ever do in your life. But it's also very rewarding.
I bet.
It's very rewarding. You actually see what is going on.
That disease
You
process.
have a bird's eye view of exactly what we're doing in the OR.
How worn out are you when a case closes?
Oh,
I mean,
you're
is it one of those ripping off the mask when you walk out?
mentally,
And mentally
sometimes.
exhausted?
physically,
Sometimes.
mentally and physically fatigued. But it's so amazing to work in a team. That's what I enjoy the most.
Like this orchestrated dance.
It is.
I
It
feel.
really is. That is. You said it. That is
A lot of
exactly what it
unspoken
is.
words where you
That
have
is
eye
it.
contact. You
Yep.
know what
And
you
that's
need.
it. That's all you need.
That's a
You got it.
special work environment, especially when you're in there saving lives. What's the big takeaway today? What do you want people to know?
You know, the thing is, innovation in nursing is one of those chances that you have to make your mark. And you never know when you're going to have an idea. Like I said, we all have workarounds. It just depends on what you do with the idea. And so I say take a chance. It's a lot of hard work, but this has been a once-in-a-lifetime experience.
When people say, why did no one ever think of this before? It's because they're waiting for
Exactly.
you to think of it. So
Exactly.
be that
Right.
person.
Exactly.
I appreciate you bringing that story because it encourages people to say, I see something that could be better. Am I the only person seeing that? So good to speak up. Speak up. What's the big takeaway as we kick off Nurses Week?
I think that, as she said, it doesn't have to just be in the operating room. It can be in any area, any arena of nursing that you can bring these ideas to fruition. Probably one of the other things is that I say, come on to the operating room. It's a wonderful place to work.
Okay, I like the plug. That's a good employment plug. Well, we're not going to turn that down.
We're just grateful for nurses in general. I mean,
Exactly.
if we didn't have nurses, where would we be
Where
in
would we be?
Where
healthcare?
would you be? As if saving lives isn't enough, now we're asking you to invent and improve the system. So that's all right. Hey, we rely on you guys for a lot. So thank you so much for all
Thank
you do.
you.
Thank you. It was a
Appreciate
pleasure.
Thanks to all of our viewers also for being with us today. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update. Little Dallas Duval was one of our smallest patients with some of the biggest needs. So why not put all her specialist scans and checkups into one visit? I'm Jessica Lovell on the next Morning Medical Update. We check in on our neonatal medical home, celebrating 11 years and making life better for babies and their parents, adding simplicity to a complex and scary time. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.